Hi, everyone. My group and I will be discussing the Tanner stages, and this group presentation is done by Bridget, myself, Jasmine, and Marissa. A quick background on the Tanner stages indicates that the Tanner stages is a scale based on the onset of puberty, and according to the Vermont Department of Health, boys and girls are rated on a 5-point scale. Boys are rated for genital development and pubic hair growth, and girls are rated for breast development and pubic hair growth. Also, the National Library of Medicine states that these stages were established by Marshall and Tanner when they were conducting a longitudinal study during the 1940s and 1960s in England. Clearly, the Tanner stages have been around for a long time, and to this day, they are still used to determine puberty. Next, I'll talk about stage 1. So stage 1 is also known as the pre-adolescent stage, and for females, this typically starts around their 8th birthday, and for males, typically starts around their 9th birthday. In terms of pubic hair for males and females, the only hair present is vellose hair, which slowly starts developing over the pubes. Vellose hair is a fine, thin hair that is barely visible to the naked eye. In this pre-adolescent stage for females, only the papilla is elevated above the level of the chest wall. And in this adolescent stage for males, the testes, scrotal sac, and penis have size and proportions similar to those seen in early childhood. Next, I will pass it off to Jasmine, who will discuss stages 2 and 3.
Hi there, my name is Jasmine Strydom, and I will be presenting stages 2 and 3 of the Tanner development process. Stage 2 is marked as the beginning of physical development, meaning in most cases, noticeable physical changes begin to happen. Boys usually experience stage 2 at age 11, with physical changes such as their testicles and skin around their scrotum begin to get bigger. Pubic hair starts to form, and in some cases, scrotal skin may become reddened. Girls usually go through stage 2 from ages 9 to 11, experiencing their first sign of breast, also known as buds. Their uterus begins to get larger, and pubic hair starts to grow on the vulva. So in stage 3, physical changes become more obvious. For boys, this usually starts at age 13. Their penis gets longer, testicles become larger, pubic hair becomes darker, they start to have wet dreams, and ejaculation is usually a result of that. Their voice begins to change, so usually it's cracks, and it has high and low pitches. Their muscles get bigger, and they experience growth in height. Stage 3 usually begins for girls at age 12, where their breast buds continue to grow. Their pubic hair becomes thicker, curlier, and hair starts to form under their armpit. And then you're going to start to see your first signs of acne start to show, and their hips and thighs also begin to build fat. I will now pass it on to Bridget, where she will discuss stages 4 and 5. Thank you.
Hi, everyone. My name is Bridget, and I will be talking about Tanner stages 4 and 5. The 4th Tanner stage is regarded as puberty in full swing. Most boys experience the 4th Tanner stage around age 14. During this stage, their genitalia, such as their penis, testicles, and scrotum, continue to get larger, their scrotum becomes darker in color, their armpit hair begins to grow, and their acne becomes more noticeable. For girls, the 4th Tanner stage occurs around age 13, where their breasts take on a fuller shape, many girls get their first period, their growth in height slows down, and their pubic hair gets thicker. During the 3rd and 4th Tanner stages, a lot of physical changes begin to occur, which can often increase feelings of gender dysphoria in children who may identify differently than their assigned sex at birth. In fact, according to an article posted by the New York Times, some transgender teens say they buy chest binders so that they can pass as male or to diminish feelings of discomfort with their body. Moreover, as puberty further develops, experts say that though wearing binders is temporary, their use can be associated with later medical transition. The final Tanner stage, stage 5, marks the end of a child's physical maturation. For boys, this means that by age 15, their genitalia will have reached adult size, their pubic hair will be filled in and will have spread to their inner thighs, their facial hair comes in, and most men begin shaving, and growth in height slows down. However, most men do not fully stop growing until around age 18. For girls, at age 15, their breasts reach approximate adult size and shape, their periods become regular after 6 months to 2 years, their pubic hair has filled in, their reproductive organs and genitals are fully developed, and their hips, thighs, and buttocks fill out in shape. Now that we have finished discussing the Tanner stages, I'm going to pass the presentation on to Marissa, who will explain how the Tanner stages relates to transgender children. Thank you.
We'll discuss how the Tanner stages relates to trans kids. Puberty is a very confusing and awkward time in any young person's life. However, it can be especially traumatic for those of trans youth. Many people of trans youth struggle with gender dysphoria. Gender dysphoria is the strong sense of discomfort for people whose gender identity does not match their biological sex. Typically, when trans children undergo the beginning stages of puberty, their gender dysphoria becomes worse, causing them a great amount of emotional pain. In order to lessen or alleviate these symptoms, it is imperative that intervention is made. For Tanner stage 1, puberty has not begun. However, it is important, if not done so already, that you are affirming the child by their preferred gender and that the social transition is being made. This means that you are referring to the child by their preferred pronouns and that they are now living life by their preferred gender. For Tanner stages 2 and 3, since onset of puberty has begun, medical intervention is recommended. In fact, according to Olson Kennedy et al. 2019, he states, in order to avoid the development of undesired secondary sex characteristics, it is essential that children in their earliest stages of puberty, Tanner stages 2 through 3, are administered with a gonadotropin releasing hormone antagonist. This means that hormone blockers known as anti-androgens must be prescribed in order to suppress puberty. For the final stages of puberty, Tanner stages 4 through 5, it is recommended for trans youth to undergo hormone therapy and gender-affirming surgeries. For trans masculine, this means the beginning of supplementation of testosterone. For trans feminine, this means the beginning of supplementation of estrogen. Once the child has reached adulthood, from that point on, they can undergo top and or bottom surgery if they wish to do so. This concludes our presentation. We really appreciate you giving us some of your time. Thank you so much for listening.